welcome back to our channel. In today's video, we're going to be talking about diabetes, a condition that affects millions of people worldwide. Whether you've been diagnosed with diabetes, know someone who has, or are simply interested in learning more, this video is for you. We'll be discussing what diabetes is, its causes, symptoms, and how to manage it. Diabetes affects how your body processes blood sugar or glucose. When we eat food, our body breaks down carbohydrates into glucose, which is used for energy. Insulin, a hormone produced by the pancreas, helps glucose enter our cells to be used as fuel. A diabetic person, his or her body doesn't produce enough insulin or doesn't use it effectively, leading to high blood sugar levels. Over time, this can lead to a number of complications. The symptoms of diabetes can vary depending on the type and severity of the condition. Common symptoms include increased thirst, frequent urination, blurred vision, fatigue, and slow wound healing. If you have any of these symptoms, it's important to see a doctor to get tested for diabetes. One of the main complications of diabetes is damage to your blood vessels, which can lead to heart disease, stroke, and other cardiovascular problems. Diabetes can also damage your nerves, leading to nerve pain and tingling sensations. Over time, high blood sugar levels can also damage your eyes, kidneys, and other organs. There are two major types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune condition that usually develops in childhood or adolescence, where the body doesn't produce enough insulin. Type 2 diabetes is more common and usually develops in adulthood, where the body becomes resistant to insulin or doesn't produce enough of it. Type 2 diabetes is a chronic condition that develops over time that results from a combination of genetic, lifestyle, and environmental factors. There are several risk factors that can increase the likelihood of developing the condition of type 2 diabetes. 1. Genetics. A family history of type 2 diabetes can increase the risk of developing the condition. 2. Obesity. Being overweight or obese is a significant risk factor for type 2 diabetes. Excess body fat can lead to insulin resistance, which impairs the body's ability to use insulin effectively to control blood sugar. 3. Sedentary lifestyle. Lack of physical activity and a sedentary lifestyle can increase the risk of developing type 2 diabetes. 4. Poor diet. A diet high in calories, sugar, and unhealthy fats can increase the risk of developing type 2 diabetes. 5. Age. The risk of developing type 2 diabetes increases with age, particularly after age 45. 6. Ethnicity. People of certain ethnicities, including African Americans, Hispanic/Latino Americans, Native Americans, and Asian Americans, are at higher risk for developing type 2 diabetes. 7. Gestational diabetes. Women who develop gestational diabetes during pregnancy are at increased risk for developing type 2 diabetes later in life. The type of medications your doctor prescribed will depend on the type of diabetes you have and the severity of your condition. Here are some common diabetes medications. 1. SGLT2 inhibitors block and prevent your kidneys from reabsorbing glucose, leading to increased glucose excretion in the urine and lower your blood glucose levels. Steglatro, ertugliflozin, is a SGLT2 inhibitor approved by the FDA in 2017. It is effective for type 2 diabetes patients and also provide cardiovascular benefits. Jardiance, empagliflozin, was approved by the FDA in 2014. Farxiga, dapagliflozin, was approved by the FDA in 2014. Invokana, canagliflozin, was approved by the FDA in 2013. 2. GLP-1 receptor agonists. These injectable medications stimulate the release of insulin and suppress the release of glucagon, which helps to lower blood glucose levels and improve glycemic control. They are usually taken once a week both type 1 and type 2 diabetes patients and can also help with weight loss. Ozempic, semaglutide, is a GLP-1 receptor agonist approved by the FDA in 2017. Adlixin, lixisenatide, another GLP-1 receptor agonist approved by the FDA in 2016. Soliqua, insulin glargine/lixisenatide, is a combination of a long-acting basal insulin and a GLP-1 receptor agonist approved by the FDA in 2016. Zoltafy, insulin degludec/liraglutide, is a combination of a long-acting basal insulin and a GLP-1 receptor agonist approved by the FDA in 2016. Rybelsus, semaglutide, an oral GLP-1 receptor agonist approved by the FDA in 2019. Ozempic, Adlixin, Soliqua, Zoltafy, and Rybelsus help the pancreas produce insulin and regulates blood sugar levels. 3. Metformin medication helps lower blood glucose levels by reducing glucose production in the liver and improving insulin sensitivity. It is usually taken with meals to reduce the risk of gastrointestinal side effects. 4. Meglitinides. These medications help the pancreas release more insulin in response to meals. They are usually taken with meals, up to 3 times a day. 5. Alpha-glucosidase inhibitors. This medication slows down the absorption of carbohydrates in the small intestine, leading to more gradual increases in blood glucose levels. It is usually taken with meals, up to 3 times a day. 6. Toujeo, insulin glargine, a long-acting basal insulin approved by the FDA in 2015 for treating type 1 and type 2 diabetes. Toujeo helps regulate blood sugar levels in people with type 1 and type 2 diabetes. 7. Sulfonylureas helps the pancreas release more insulin. They are typically taken once or twice a day with meals. 8. DPP-4 inhibitors helps regulate blood glucose levels by preventing the breakdown of a hormone called GLP-1. It is usually taken once a day with or without food. 9. Thiazolidinediones improves insulin sensitivity in the body, leading to lower blood glucose levels. It is usually taken once a day with or without food. 10. Basal insulin provides a steady level of insulin throughout the day and night, helping to regulate blood glucose levels. It is usually taken once a day, usually at bedtime. 11. Bolus insulin is taken before meals to help regulate blood glucose levels. It can be taken with a pen or pump, and the dosage will depend on the amount and type of food being eaten. 12. Closed-loop insulin delivery systems are known as artificial pancreas systems. An advanced insulin pump uses a continuous glucose monitor, CGM, to automatically adjust insulin delivery based on real-time blood glucose readings. This can help to improve glycemic control and reduce the risk of hypoglycemia. It is effective in managing both type 1 and type 2 diabetes. It's important to note that these medications have different mechanisms of action and may be prescribed based on individual patient needs and response to treatment. It's essential to work with a healthcare provider to determine the best medication and treatment plan for managing diabetes. While there is currently no known cure for diabetes, however, there are several effective ways available to help manage diabetes, control blood sugar levels, reduce the risk of diabetes-related complications, and maintain overall health. One effective way to manage diabetes is through healthy lifestyle changes. 1. Eating a healthy and balanced diet. A balanced healthy diet is essential for managing blood sugar levels. Focus on foods that are low in sugar, fat, and calories, high in fiber and nutrients. This includes whole grains, fruits, vegetables, lean protein, and fish. Avoid sugary and processed foods, which can cause blood sugar spikes. 2. Stay active and exercise regularly can help lower blood sugar levels, improve insulin sensitivity, reduce the risk of complications, and improve overall health. Aim for at least 30 minutes of physical exercise per day. Walking, cycling, swimming, and dancing are all great options. It's also important to quit smoking and maintain a healthy body weight. 3. Manage your stress levels. Stress can increase your blood sugar levels, so it's important to find healthy ways to manage your stress effectively. Some effective stress management techniques include deep breathing, meditation, or doing activities that you enjoy like listening to soothing music or watching shows that make you laugh and relax. 4. Get enough quality sleep. Sleep is essential for overall health and well-being, and will impact your blood sugar control. Lack of sleep can disrupt blood sugar levels and insulin sensitivity. Aim for 7 to 8 hours of quality sleep per night. Create a bedtime routine, avoid caffeine and electronics before bed, and keep your bedroom cool and dark for optimal sleep. 5. Stay hydrated. Drinking enough water is essential for overall health and can also help regulate blood sugar levels. If lifestyle changes alone are not enough to manage your blood sugar levels, your doctor may prescribe medications. There are several types of medications used to treat diabetes, including metformin, sulfonylureas, thiazolidinediones, and DPP-4 inhibitors. These medications work by either increasing insulin sensitivity, reducing glucose production in the liver, or increasing insulin production. For some people with diabetes, insulin therapy may be necessary. Insulin is a hormone that helps glucose enter your cells and be used for energy. If your body doesn't produce enough insulin or doesn't use it effectively, insulin therapy can help regulate blood sugar levels. Insulin can be injected using a needle and syringe or through an insulin pump. It is important to take your medication as prescribed. Make sure you understand how to take your medication, when to take it, and any potential side effects to watch out for. It's important to take it as directed by your healthcare provider and take your medication at the same time each day. Checking your blood sugar levels can help you identify any patterns and make adjustments to your treatment plan. Make sure to record your readings and bring them to your healthcare provider for review. Acupuncture is a traditional Chinese medical practice that can help regulate blood sugar levels and improve insulin sensitivity. Acupuncture can help alleviate symptoms of diabetes, such as nerve pain and tingling sensations. Studies found that regular acupuncture treatments can lower fasting blood sugar levels and reduce HbA1c levels. Do ensure that you find a licensed acupuncturist who has experience treating diabetic patients. Some foods such as bitter melon, fenugreek, and cinnamon can help to lower blood sugar. Bitter melon, in particular, has been shown to reduce blood sugar levels and improve insulin sensitivity. Fenugreek can help lower fasting blood sugar levels and reduce insulin resistance. Cinnamon has also been found to help regulate blood sugar levels by improving insulin sensitivity. While acupuncture and foods can help regulate blood sugar levels and alleviate symptoms for some people, it's important to talk to your doctor before trying them, because they may interact with the medications you are taking and cause side effects. Thank you for watching. If you enjoyed this video, please like and share it with your friends, and don't forget to subscribe to our channel for more videos like this.